Before we start today's media briefing, I do want to take a moment to acknowledge Dr. Malcolm Locke and recognize his contributions to healthcare and public health in the community he served for many years. Dr. Locke's career was a true testament to his unwavering commitment to both his private practice as well as his public health practice. I know I speak to many when I say he will be missed. In light of his passing, I will deliver today's measles updates for both the Southwestern Public Health and Grand Erie Public Health regions. Both of our communities are in a measles outbreak, and there is evidence of community transmission. Both of our health units have had a significant number of cases reported to us. However, we also recognize there are likely additional cases that have not been identified and that have not been reported to public health. And while public exposure notifications can help inform people, this is not a reliable way to assess your personal risk of measles exposures because cases are circulating across our regions. And as I mentioned earlier, there are many cases that have not been reported to us. You could be exposed to measles at any time during the outbreak that we are experiencing. In terms of cases in both of our regions are predominantly affecting individuals, mostly children, who are not up to date with their vaccinations. So if you are not up to date, you are at high risk of measles. On the other hand, this is reassuring for those who are vaccinated in that your risk of measles is very, very low right now. 2 doses of measles vaccines provides up to 99% protection against this virus. And we are seeing benefits of this vaccination real time today with very, very low rates in vaccinated individuals contracting this virus, even with significant exposures and cases circulating around us. I want to take a moment to talk to those of you who are not up to date with your vaccines or have not received protection through immunization for you or your child. Measles is an incredibly contagious virus that should not be taken lightly. We are seeing serious complications in children who have measles who are being brought to hospitals due to breathing difficulties, increased heart rates, and extreme dehydration from diarrhea and vomiting, as well as very high fevers. Please avoid healthcare settings, including hospitals, unless you require medical care for worsening or severe symptoms. If you do require care, do not delay seeking support from a medical professional. But please call ahead to inform them of your symptoms and concerns about measles so that they can prepare for your arrival and take additional appropriate precautions to prevent others from getting sick too. If you are pregnant, have an infant or young child at home, or you have an immune compromising condition, you are advised to avoid situations where you might be exposed to someone who has measles. This is also a good time to postpone play dates, visits, and other get-togethers with these high-risk individuals if you have measles, or someone else in your house has measles, or you know you've been exposed to measles. So for clarity, what I mean by measles symptoms, because measles symptoms can resemble respiratory illnesses at first. Talk about cough, fever, GI symptoms, conjunctivitis. Rash is not the first sign of measles, and it can develop several days after your other symptoms begin. You are most contagious the 4 days before and the 4 days after the onset of a rash. This is also a good time to remind those who have measles to stay home, rest, and keep yourself and your children well hydrated to avoid some of these impacts from measles infections. To prevent more children from becoming ill, anyone who has measles is advised to avoid schools or daycare settings, including students, but also staff or visitors who have measles. In terms of vaccinations, anyone born in or after 1970 can arrange routine measles vaccinations through their healthcare provider. 2 doses are recommended for this age group. Specifically, there are additional clinics happening in both of our regions. Southwestern Public Health is also offering infant-focused vaccination clinics during the month of March for babies 6 to 11 months who live in Elgin or Oxford counties or the city of St. Thomas. Appointments can be booked at www.swpublichealth.ca/booking. Likewise, Grand Erie Public Health has vaccination appointments as well, available in their region as well. More information about measles vaccine appointments is available at www.bchu.org/measles, as well as www.hnhu.org/measles. As a community, I urge you all to be cautious as it relates to measles, especially if you are one of those most at risk for this virus, or you are undervaccinated or unimmunized. Measles is not COVID. This is a virus that has a long history of infection around the world. It is very preventable through an effective vaccine that has been available in Canada for generations.